Bladder cancer survivorship means life-changing, not life-ending, maximizing quality of life through multiple means, living the best life possible despite the diagnosis, being able to live without fear. And these just are a couple of words that I've taken from the pre-event survey that many of you completed. And our next session is really focused around helping you achieve those goals. The BCAN Survivorship Task Force was formed in 2022 with the goal to better understand the needs of bladder cancer patients and caregivers, and also to improve survivorship care. The task force is composed of clinicians, patients, and caregivers. And many of the members of that task force are present here today. The task force is led by two amazing women, one of them who's here, joining us in person, and another one who's joining us remotely, all the way from California. I will be introducing them in just a minute. But from the two of them, you will hear about the history of the task force. They will go into more information around what the term survivorship means, and we'll share some of the accomplishments of the task force. So let me go ahead and introduce our speakers for this session on navigating survivorship. Mary Dunn, who's present here today, joined the University of North Carolina Department of Urology in 2010 and has served as adjunct faculty for the UNC School of Nursing since 2011. Mary works in a multidisciplinary nurse practitioner role with urology and medical oncology, providing comprehensive care to patients with genitourinary malignancies. She's a member of the Lineberger Comprehensive Cancer Center, and her unique role allows her to promote or provide autonomous patient-centered care while closely collaborating with internationally recognized providers and researchers in the field of urologic oncology. Krisztina, who is joining us remotely, is a nurse practitioner specializing in kidney and bladder cancer care, as well as ostomies, neobladder reconstruction, and complex urinary tract infections. She also supports cancer survivors through cancer surveillance and quality of life care. Krisztina earned her bachelor's in molecular biology and a master's in public health from UNC Berkeley with a Fulbright fellowship in Brazil. She holds a master in nursing from UCSF and is a member of the American Urologic Association and Society of Urologic Nurses and Associates. So without further ado, please help me and welcome our guests, our speakers for this session.
Thank you. Good morning. Can everyone hear me okay? Yes. It's great to see so many faces. So when Steph and Patricia were talking and they started talking about buttons, I was like, wait a second, I have some buttons. So I went and dug in the end of my, my backpack, and I wanted to share with you guys, just as a little icebreaker, before we get started, what some of the buttons at the AUA are, okay? So we have, and if you want to see them later, I'm happy to share. You can't have them, though. This is, so I'm a big baseball fan. This is Field of Streams, which is fantastic.
Urologists have a sense of humor.
Oh, it's great. It's great.
You can't do this job if they didn't have a sense of humor.
No. We have Stream Team, which is a great team to be a part of. I work with testicular cancer patients as well, so this is one of my favorites. Besties work with testes. We love that. We have the Erectoral College.
Very pertinent these days.
So I think some of you in the room have heard my sex talk, so I love this one in particular. I give a sex talk. And then this one, I think the context here matters, because from here, it looks like it says size matters, But in little tiny letters, it says prostate size matters. So that's all about BPH related things. So that was my little icebreaker. So thanks for the button reminder that I had those in the bottom of my bag for, gosh, since May. I don't know how many of my patients would appreciate me wearing those to work. But anyway, I'm thrilled to be with you all this morning. Gosh, we've been doing this a long time now. I've been had the pleasure of being involved with BCAN in some way, shape, or form for about 14 years now. And being a part of this organization and all the hats that I've worn over the years is one of my biggest professional honors, and I thank you for all the support over the years. I'm thrilled to be joined remotely, hi Krisztina, by my partner in crime on the West Coast, so we're like the East-West Coast twins. So it's early there, and Krisztina, thank you for being here. So I'm going to go through some slides, but I want to keep this relatively informal. But I think kind of talking about how we started and why we're here and the things we've accomplished as a task force, and then my ultimate goal is always to recruit more people to get on the monthly Zoom calls with me. So if anyone's interested at the end, please come and see me. I'm more than happy to take your information and get you involved. I do, however, before we get started, anyone who is currently part of the task force who is here, could you raise your hand just so we could see? Thank you guys so much. Thank you. And who has answered one of the many surveys that we've sent out, whether it's ahead of a think tank, ahead of a patient summit, some random email with my name on it? I know many of you have answered a lot of our surveys as well. So thank you for that. Like your input there is really what's helping drive the priorities for this task force. So thank you all so much for your ongoing participation. All right, so let me see if I can properly work the clicker.
You'd have to aim it that way.
It's the big green button, right?
It is a big green button. Let's see.
I'm good at many things, not this.
Ta-da.
There we go, look at that. Okay, so I'm a sucker for an agenda. That's just the way my brain works. So we kind of went through the welcome, and we're gonna have a brief history lesson, talk about Survivorship 101, highlight the accomplishments from the task force that we've been able to check off our list for this year, talk about projects that are in the works, and then open discussion, like I said, the way that we are able to continue this work that's focused on bladder cancer survivorship is by getting the input from the people that it directly affects. My apologies if I don't always look over here, you guys. I know that you're here, but straining a little bit. So with that, we've been doing this for what seems like a really long time, but really it's not been that long. You know, we started at the think tank a couple of years ago where we had a breakout session that was dedicated to bladder cancer survivorship, and we did this big pre-survey of folks who were going to be attending, and it was broken up between patients who were going to be coming and a provider survey as well to kind of be able to figure out which topics related to survivorship should we be focusing on. And from that particular breakout session came our task force. And our task force, we meet to talk about how the greater BCAN community can meet the needs of survivors and continue to identify gaps in survivorship care and resources and discuss projects. So we continue to develop more focused patient and provider surveys based on that initial meeting. And then at the 2023 Think Tank breakout session, we continue to review survey data, and some really hot topics started to kind of come to the surface. Once we asked all the big questions, then we were able to narrow some things down, so that we needed space on the BCAN website dedicated to survivorship materials. We talked about care plans, which we'll talk about later on in this presentation, and then guidelines for how do we better provide bladder cancer specific survivorship care outside of just kind of the general NCCN guidelines, which many folks are aware of. And then we met in Nashville last year time runs together. I think it was Nashville last year. And man, that was a fantastic discussion. I don't know, who was in Nashville last year? I know some folks who were there, yeah. That was fun, wasn't it, Krisztina? Man, that was a robust discussion.
I think it was our first meeting together.
It was, yeah. It was the first time we'd actually talked about all of this, like on the bigger stage and not just at a breakout session. And I was like frantically taking notes like a high school teacher.
In your Beacon book.
And in my Beacon, right? Like I have like 700 of these. It's a little ridiculous. But we got so much useful information from that we were able to see new patterns starting to emerge as to where we should focus our attention, where we should focus our resources. And then I got to zoom in at the spring because I couldn't go all the way to Seattle. So, Krisztina, I don't know what you can see, but when I zoomed in at the Spring Summit, I got to see like the back of everyone's head, so it felt like I was talking to everyone's skulls. That was really weird, but that was really, again, nice, robust discussion. What we really want this to be is a place where everyone can feel like they can be their authentic selves. If we don't know what's affecting all of you, if we don't know what is not being done well in the context of survivorship care for patients with bladder cancer, then we can't help. And that's what we want to do, is to help and change the landscape here. So our task force has ongoing work. We have quarterly-ish meetings when I can get my act together. Thankfully, Stephanie and Patricia keep me honest with that. And then we have a lot of action items that we've completed and works in progress. And everyone who is on the task force knows that their number one job is to keep me grounded, which is really hard to keep me grounded. This work has been certainly a marathon and not a sprint, but I want to get all the wonderful things done right now, but that's not how it works in the real world. Krisztina, anything to add to my little history lesson?
No, besides we went to see Carrie Underwood.
We did. Yeah, we did. Yeah, that was fun. That was fun. After all that, I was like, oh, I gotta decompress. And Grand Ole Opry, snagged a ticket, saw Carrie Underwood. Who knew? That was fun. Who knows what I'll do in Philly? Is it hockey season yet? I really like y'all's mascot, Gritty. It's a horrifying thing, but I like him. So I don't know if it's hockey season yet, but anyway, maybe he can make a guest appearance at dinner tonight. Make a few calls. So what do we know about survivorship? So survivorship means different things to different people. For a lot of people going into a cancer experience, the thought process when they think about surviving is that means I have to be done with my treatment, I have to have no evidence of disease, then I'm a survivor. But in more recent years, we've really kind of unraveled that way of thinking, and that one of the more accepted definitions of survivorship in general is at the time of diagnosis and through the extent of one's life, one is considered a survivor. So kind of living with, through, and beyond cancer. We always like to kind of recognize that the word survivor doesn't always feel right to everyone. That some people just don't like the word, and that's okay. We're never trying to like label anyone anything that they don't wish to be labeled. That's just kind of the most broadly accepted term. So if that doesn't feel right to you, that's okay too. And then there's individual challenges and concerns when it comes to navigating the cancer survivorship process. And I tell my patients all the time, we could take two people who are of the same age and race and gender and diagnosis and treatment path, and they could have two very different outcomes and have very different survivorship-related needs. So this is certainly not a one-size-fits-all process, and it's very nuanced. So some general cancer survivorship data. So this is not bladder cancer specific, but there's over 18 million people with a history of cancer currently living in the United States. And what we know is that the number of cancer survivors is projected to increase by almost 25% by 2032. So that's these are huge numbers. So what does that mean for us? So my side of the street, it means we need to figure out how to do this work better and provide this specific nuanced care better. Part of the problem that is not a problem for you all, but a larger problem for us is that there's already kind of a shortage of us, so those providing the care, and as we are having more patients being diagnosed with cancer, living longer with cancer, that's one of the challenges that we face is with a shortage of providers, how are we still going to be able to ensure that we are providing the care that folks need? We also know that in the next 10 years or the next decade, the number of people who have lived 5 or more years after their cancer diagnosis is projected to increase by about 30%. So again, these are large percentages here. This is good, right? Like, this is great that people are living longer after a cancer diagnosis, that people who have advanced disease or metastatic disease are living longer with their cancer because we have new treatment options, we have different treatment options. And it means that we need to make sure that we're not just saying, okay, that 5-year arbitrary mark, see you later, have a nice life. We need to do a better job of preparing people for what their lives are going to look like before, during, and after treatment, and making sure that we're addressing those very specific needs along the way. So these data are a couple years old, but it updates every couple of years. So there's almost 800,000 people living with bladder cancer in the United States. That's from 2022. We know that for all stages combined, the 5-year relative survival is about 77%. And we know that post-treatment surveillance is crucial. So whether it's non-muscle invasive bladder cancer, muscle invasive bladder cancer, and something that we haven't in the survivorship space focused on historically is people who are living with advanced disease or living with metastatic disease that may not be curable. That is something that, as part of this task force, we are focused on because we feel like there are survivorship needs for folks who are living with advanced cancer as well. We know that there's really no standard of care outside of the kind of follow-up guidelines from the NCCN for managing post-treatment and long-term survivorship needs. So those are some things that we're exploring in the task force as well. I actually haven't seen this. So, this has been like blood, sweat, and tears for like 17 years now. I didn't know it was on the table. I need to like run out there and get it. I'm so excited. So, Krisztina, anything to add to that before we kind of talk about things that the task force has accomplished to date? Look how pretty it is. Oh, it's so pretty.
No, I think you summed it up perfectly, and there's been a lot of work going into this over the years. And I think it's really nice seeing some feasible products.
Yes, it is. It's funny because if one looks at that piece of paper, it is an piece of paper with 2 sides. You think, oh, they can get that done in a month. No. Has anyone ever been on a call with a lot of people who have a lot of opinions? Yeah. And we cherish your opinions. We truly do. Each and every one of you, because this work wouldn't get done without the voices on these Zoom calls and without the emails that people send me, the text messages that we get. So I am so proud of this fact sheet. I think we worked really hard on it. Apparently there are hard copies, so you don't need me to show you this, but there are pretty hard copies. This is to kind of jumpstart the resources that we have for the survivorship survivorship part of the web page that's specific. So if you've looked at any of the other fact sheets in the past, they're broken up really nicely into defining certain things, what to ask your healthcare team, what to look for, et cetera, resources and contact information. So we kind of took existing fact sheets and worked from there. But this had like red ink all over it for about 6 months, and we finally came to a consensus on what belonged there and things that we could include in other things. So this is Get the Facts Survivorship 101. So I would encourage all of you to grab a copy or scan the QR code, because it's much prettier than this screenshot that I pulled and put on this slide. I'm sorry, that's really unfortunate looking compared to the actual sheet. So I would encourage you to kind of use this as a starting point. If you're wondering, what does survivorship mean if the folks who are providing you with your care at your academic centers or your local centers have questions about what does bladder cancer survivorship look like? How is BCAN defining that? What are some things the task force is doing, and what are some things that you should be asking your providers in this context? Print these off. Take a handful. Apparently, I promise I won't take them all. I'm gonna go home and pepper the living room with them. I think Carlos would be not thrilled with that choice of wallpaper, but I tend to be excited about all my BCAN stuff. So please feel free to take some. This is something that I think it's quick, it's easy, it highlights important facets of survivorship care. So thank you. Many of you in the room had a hand in making this work. So this also had about 100 iterations before we got to this final definition, but the task force thought it was important to define bladder cancer survivorship. So there's a lot of, like we talked about in the beginning, a lot of generic kind of widely accepted definitions of cancer survivorship, but we really wanted to make something of our own. And Stephanie has always been really good with the visual part of this, so the life raft and the life vest and the things like that. So I've always kind of loved the life raft, kind of out in the middle, and we want to be your life raft. So a person is considered a cancer survivor from the time of diagnosis through the balance of life. Survivors include those living with cancer and those who are free of cancer. Bladder cancer survivorship means receiving patient-focused care. It involves teamwork among different healthcare professionals at every stage of the cancer journey. Each patient has unique and complex experiences. Survivorship care is not just about test results and follow-up visits. It promotes health and other disease prevention strategies, manages treatment side effects, and supports the emotional well-being of patients and their families. Does this resonate with anyone? If you don't raise your hand, it's okay. Nothing offends me anymore, right? This resonates, though, right? This feels comprehensive. It feels comprehensive without being too comprehensive, right? It was super, super specific, and then we decided that a definition of something could not be 7 paragraphs. So we kind of narrowed it down, but when we had kind of our first draft of this, there was a lot of specifics in there, really important specific things that pertain to patients who have had a bladder cancer experience or continue to have a bladder cancer experience. But what we did once we kind of inked this many times over was take out those super specific things, and I have this running list of all the projects that are eventually going to get done before I retire. And a lot of that includes honing in on some of those specific things that we took out of the general definition. So you will see things upcoming like mental health, financial toxicity, sexual dysfunction, things that have to do with conduits, all kinds of things that are specific to bladder cancer survivorship that were just too much for a definition. So we took out a lot of those things, and you will see those things being developed over time. And as they're being developed, we're going to find ways to make sure we get that information to you so you can have it, know that it's there, and also disseminate it around to the folks who are working with you during your cancer experience. Anything else there, Krisztina? You know, all I like to do is chat. Please cut me off at any time.
Yeah, no, I love listening to you.
I think you might want to be the only people who likes listening to me. So thank you everyone again in the room who helped to make this definition come true. All right, so we do have dedicated space on the BCAN webpage now. Thank you, Mark. Where are you? Thanks, Mark. Appreciate you, Mark. So this is a work in progress. I am not savvy enough to do whatever Patricia did to actually show the web page. But if you go to BCAN and you look up top somewhere, I'll figure it out and we'll show you later. But there's an actual survivorship. So click on that, and then it opens up the Survivorship webpage. This is a work in progress. This is not a finished product. So again, we have a whole subset list of things that are eventually going to be on there. And what we're going to do is, kind of our vision here is there's a lot of things that already exist on the BCAN webpage that pertain to the survivorship experience. We're going to, we've had awesome people kind of digging through that content to pull stuff out that we're going to leave and where it already lives on the webpage, but also incorporate it onto the survivorship specific space so that it's like easy to click those links and get where you need to go. But more importantly, we are working on creating material that just doesn't exist, that we feel like needs to be part of the survivorship space. So we're continuously looking for feedback on what should be included there, and we're going to continue to add. And there's going to be, the way that we have it envisioned is there's going to be sectioned off for, this is the survivorship specific material for patients, for caregivers, and then we're going to have a section for providers, so for people like me. So for folks who in the community or even at academic medical centers who are not familiar with survivorship specific needs, they'll have a place to go like, oh, that's what a survivorship care plan looks like. That's something I should be incorporating into my practice. So the materials are going to be a little bit different depending on kind of who you are and what you're looking for, but that's the big vision here. Anything else, Krisztina, or Steph, or Patricia, or anyone on the task force, or anyone in the audience? No? Okay.
The evaluation will have an opportunity for comments, so if you're thinking of something, write it down in your book, and then make sure when you do your evaluation, you include that, because we only learn by hearing from you guys. This is so important. We think we know what everything is that you need to have, but this is where it's really important.
Sorry, for you guys to weigh in. So the evaluation is a great opportunity to do that. And you get to win a BCAN jacket if you do your evaluation. There's an opportunity for somebody to win a BCAN jacket.
Can I have it? I'm cold. I just bundle up. No, I already have. I've got one. It's fine. It is cold up here. So we should have time. We should have some time for Q&A back and forth. Mm-hmm. Okay. Who in the room has been given a survivorship care plan? Oh, for the love of the lambs. No? One person. Someone lie. Someone just lie. No? Everyone's honest? Okay, all right. Okay, this is like why I have like constant like low-level chest pain. I feel like it was the same like crickets in Nashville last year, if I remember. I think it was different in Seattle. I feel like some folks in Seattle had.
Fred Hutch is on their game.
Yeah, they've got their game. Does anyone know what a survivorship care plan is? No. All right, so some folks know. Ish, kind of, a little bit. Okay. All right. So we are. So from the task force, we have created a separate task force. I mean, there's always like how many meetings do we have every week? A separate working group, we'll say, that is advocates and clinicians who are specifically interested in helping to create a bladder cancer specific survivorship care plan. So there is, I'm so sorry, I'm not good at this. There is one that exists. It is over a decade old at this point. It was put together by Cheryl Lee and Heather Goltz and Dave Latini many, many years ago, and they did a beautiful job. Yeah. And it's time for a revision. It's time for a revision, and it's time to actually get this disseminated out to folks to use. So in theory, survivorship care plans are documents that at a certain point, depending on your stage of cancer and what treatment you got and where you're being seen, et cetera, is basically a document, and we usually like to keep them relatively short, that has a summary of your treatment history. So it usually contains things like demographics, when you were diagnosed, what stage, what was the subtype of the tumor, what treatment you received, those types of things. Your treatment team their names, their contact information, and then after kind of those highlights from your cancer experience and treatment, things like living well, when to be up to date on other cancer screenings, healthy living, talk about things like tobacco and exercise and those types of things, and also what to look for as far as post-treatment late effects and long-term complications. So that is something that every institution does very differently. It sounds like a really easy thing to implement. It is not if there's no buy-in from the people who need to be implementing them. There's a lot of barriers to getting these types of things done, and it varies depending on institution to institution. So at UNC, for folks, for example, with muscle-invasive bladder cancer, who have had radical cystectomies, just to kind of use one of the pathways that we do, I will see those patients back for a 6-week post-op visit, and at that, so they have their initial post-op, and then their 6-week visit is what we call their survivorship care plan visit. So that's to make sure that folks are doing well still in that early recovery process, but also to go over their care plan. Because at that initial post-op visit, it's overwhelmed by here's your pathology, here's the follow-up, here's taking your stents out, how are you doing, et cetera. So to go over a document at that visit makes absolutely no sense, because it's not going to be received in the way that we want it to be received. So we have a separate visit for that, and that's where we really sit down and talk about what's the follow-up plan going to look like. Here are some things that you may run into. Who are you going to see for your follow-up visits and why? What's going to be done at those follow-up visits? And here's a list of all of the different resources that we have available for you at this time in your cancer experience. Because it feels weird, right, when you're done with treatment for folks who have definitive treatment. It feels a little bit like a breakup, because at first you're together all the time, and then you're not. So those visits are crucial, and that document is crucial because it makes you feel like, okay, I know what's going to be happening in what time frame and who is going to be providing that care. Another big component to those care plans is that they're meant to serve as a what's the word I'm looking for? Communication tool between the oncology team, whether that's your urologist, medical oncologist, radiation oncologist, whomever, and your primary care provider. There's been a lot of research done about the communication between oncology and primary care, and we still have a lot of room to grow, because you still need to be seeing your primary care docs, your primary care providers, right? So we use that as a tool so that they understand what folks are going to be doing as far as surveillance, some potential late-term side effects, so that when you're seeing them for your annual visit and you're like, yeah, I just had this like really annoying like ringing sensation in my ears. Anyone ever had that before? Yeah, probably. Yeah. Then your primary cares can be kind of clued in on, oh, that's like a potential consequence of the chemotherapy that you got. So that's what a care plan is. There's lots and lots of versions of them out there. But we want one that is very specific to bladder cancer. So the current task subgroup is working on 3 separate care plans. So we're going to have 2 subgroups. So one is going to be a clinician-focused care plan that is very, it's much more technical than one that's going to be more patient-specific. So we have currently gone through non-muscle invasive, muscle invasive, and advanced disease. Those, I think, Patricia sent to the people who make them pretty, much prettier than my like 5-year-old Word document that I try and put together. But those are going to be ready to be launched in the relative near future. So thanks to everyone who has had a say in that. That's been quite a haul. The next step after we get those done and disseminate those out is we're then going to turn our attention to create a patient-focused survivorship, bladder cancer specific survivorship care plan. So we're going to bring our patient advocates back on the calls and work on those. And those are going to look different, because we know that the information that providers need is different than the information that our patients and our caregivers need. So the goal is we're going to have these available on the BCAN website. We're going to come up with a plan on how to disseminate them, And then in different institutions, you know, the goal is to not have, I have to keep my expectations low, to have these available, and there's just a lot of barriers to getting these things, you know, out to every single person. So the way that these work are going to vary depending on institutions and electronic medical records and how they're incorporated and things like that. But we're starting the groundwork, and that's the goal here. We are also, thanks to suggestions from folks, we will be making one for upper tract urothelial as well. Krisztina, what have I left out of the care plan stuff? Or anyone who's helping with care plans in the audience?
Nothing. I think after our last call last week, the care plans are in a really, really good shape. And I think we trimmed down the original 30-page document to
It was long.
You know, so I think this is as close as we will get. And I just wanted to emphasize that in all these calls, we have a lot of patients and patient advocates. So especially the patient-focused care plan, it's really going to be the voice that we hear from you all.
Yeah, thanks, Krisztina. So if anyone wants to be involved, please let us know. All right, I don't remember what. Yes, hi.
About the care plan. So I don't have one, and I'm going to Fox Chase, which is a big institution right here in Philadelphia. But I keep my own Excel sheet.
Love that.
Thanks, Fran.
Since the day I, is it on? Since the day, is it on?
There we
It's
go.
on.
Since the day I was diagnosed, I started keeping, and so it's in chronological, like the most recent stuff is at the top, and just like you said, it has who my doctors are, every BCG treatment. I even have little comments if I want to put them. But I guess I'm curious, your care plan, would the institution like kind of pre-fill all my medical treatments, and then I have the opportunity to add my own opinions or notes, or is it the patient that will download an empty plan and fill it in, you know? How do you see it working?
Yeah, that's a great question. Thank you, and thank you for being my new best friend with your spreadsheets. Sure, get your email. You're not going to get rid of me. So that's a great question. So it could go both ways. So and I can speak from my experience at UNC. So we have Epic. I'm sure many of you may be familiar with Epic as an electronic medical record. When I click a couple buttons to get to the care plan, and then the things that are pre-populated get pulled into that care plan. So if someone has received chemotherapy, it gets pulled into the care plan. The names of their providers gets pulled into the care plan. Surgery gets pulled into the care plan. And there's a couple of things that I have to do, click a few buttons, and then it's done. There are definitely glitches because unfortunately, like, every single surgery someone has had gets pulled into the care plan. I care about your appendectomies. I don't care about them in the context of your bladder cancer survivorship care plan. But so there's glitches in the system. And these templates will also be available for folks to like print off and have, like, if you want to also like do your own thing in addition to whatever your institution may provide. Absolutely. Thank you for the question. Absolutely, yes.
But again,
Yes.
every institution has its own system. There's the MyChart, there's the Epic, there's like 5 or 6 different types of care plans or medical record systems, electronic medical records. So the challenge, of course, is finding something that can be implemented across all different systems, which is why it's really helpful, we think, for patients to have their own copy. So I bet some of you, raise your hand if you have a notebook, a binder. Okay.
Yeah,
You have a binder. How many keep a spreadsheet? Some of you are spreadsheet kind
Is
of
it
people.
color coordinated?
Yeah.
No one's as neurotic as me? No? All right.
So keeping track of your information, we don't remember everything. And all of these things, when they say, well, did you ever have this? It's like, I don't know. You know, keeping track is really helpful. So the tool can be very helpful for all of you all to be able to have on one document that you put in a folder somewhere, or you keep it on your computer as a living document that you keep adding to just kind of keep track. Because when your doctor asks you these questions, you're like, I don't know what I did 5 years ago, I don't remember. So isn't it in my chart? And you know, if you change doctors, if you move, then maybe that's not following you. So it's really important for you to be responsible for your own information.
That's right. Thank you. All right, let's talk a little bit about what's in the, oh, sure, yeah, sorry.
Yeah, I have 2 questions just to follow up on this. Is there a difference between a treatment plan and a care plan? Because we have a detailed treatment plan. This happens at these months. This is the treatment you get. This is the test you get. This happens if this and that. So the treatment plan, is that different from a care plan? And secondly, your point about Epic and the records and getting your PCP involved and knowledgeable. Do you have a suggestion about how to deal with the inconsistencies in the transmission and storage of medical records? Because, you know, we have a great PCP and an incredible place that does the treatment, but literally every time you want the treatment place to send something to the PCP, you have to fill out, and I'm talking about a huge institution.
I know.
You have to fill out a form in writing. They have to, you know, so how can we make that transition better and the difference between treatment plan and care plan?
Thank you so much. Your treatment plan should be incorporated into the survivorship care plan. Like that should all be outlined in there with the other things that we kind of talked about. How to fix communication is on my list of things to do before I retire as well. It is an extraordinarily...
She'll never retire, just saying.
I have a plan. You know, I talked to Karen about my plan last night. There's always a plan. It's so hard. Like the fact that I still have to fax things like makes my hair gray, right? That's why I have to dye my hair, right? Like you shouldn't have to be faxing things. Things should be talking to one another, but unfortunately the systems are still broken. You know, and this is not, I'm not bashing any electronic medical record system. This is just like the nature of what we see every day, right? Like I can see certain things from certain institutions, but you know, I work in North Carolina, and if someone has a primary care provider that's in this tiny little town in rural North Carolina, they're not going to be connected to Epic. So you know, I rely on, like at the end of a note, there's a communications tab. I click communications, send to care team, which is primary care and cardiology and whomever. Cross my fingers and hope that the transmission works, right? It's not seamless, but I hear what you're saying, and that's like communication between cancer providers and other providers is actually something that has been pulled out of this task force as something to talk about in the future. So you're spot on there. That was a non-answer to your question. My apologies.
Well, just a quick follow-up. I don't know the details of this, but I had heard that HHS or some government agency for a year from now has proposed required changes in medical record systems so that for people to get federal funds, whatever it is, the systems are going to have to communicate electronically. And if that's really being proposed, it would be really good if BCAN itself could weigh in on that, because you could be a voice and explain how difficult it is, and maybe on behalf of survivors say, hey, this is a great idea. We can't do all of these care plans and treatment plans and integrated services unless the providers can talk to each other. And if the industry doesn't want to do that voluntarily, you know, then yeah, the government should do it. You know, we got one outlet for electric phones. I mean, everything communicates, and it's very weird in 2024, 2025, that medical facilities can't communicate with each other the same way. So thank you very much.
Yeah, of course. Thank you. Thank you.
Hello.
Oh, hi.
One more. So how will your system keep up with the evolving standards of care? In other words, I think you have a lot of physicians around our country who have different ideas about standards of care. And will this be descriptive, proscriptive, prescriptive? How does that work?
Like in the context of survivorship type things? I don't know that I have a great answer for that question. I think, I just had a thought and it went out of my head, sorry. We can talk later. Yeah, we can. I think that's a little bit tricky, because there are things that are evolving, and lots of interesting data that's come out. And I think, because we talk a lot in Tumor Board, the past, like since ESMO, right, a couple weeks ago, about, oh, this could potentially be practice changing. What does this look like now for standard of care? And I think it really does depend on institution and particular person prescribing the care. Yeah.
So this is really talking about this idea that this is a living, working group. It is not, we have an end date, we're going to make this thing, and it'll be done. It will have to evolve over time, and it may ebb and wane with Beacon's efforts, because things might be kind of static for a little bit, and then all of a sudden new treatments come out, and then it's like, oh, we got to add all these other options, and now we know more about something else because there's been a definitive paper that's written. So I think that's where it becomes fluid. As much as I would have thought when I joined Beacon 10 years ago, you know, our goal obviously was to put ourselves out of business, but that's never going to happen. Cancer is more and more prevalent in our world today. We're going to be here to support the needs of those who do have bladder cancer, and we have a job to do. And so Mary, we're going to need to bring in the next round of the youngins to take over for us when we do retire. Because someday you might want to retire. Well, I know I have a vision, I have a plan for, you know, leaving. But again, the idea is we need to make sure that we keep this going. We do have some really exciting younger people involved, and so that's part of this whole working group, that it's a collective effort. It's not Mary and Krisztina doing it, and oh my gosh, if something happens to one of them, we're in trouble. It's not. There are a lot of people working on this. So that's where, you know, again, it's more proscriptive. It's an ever-changing thing as standards of care change. Survivorship is still survivorship, and it's, you know, we've got all these other things. Who knew about the pandemic 3 years ago? If we knew that, we'd all be in a different place. But we have to accommodate, and therefore we accommodated for that and everything else in our lives. So it's not a static thing. This is a living, breathing, working group.
I have one comment on that.
Yeah.
Don't you think?
Can we get the microphone?
I've pretty much lived in Pennsylvania my whole life, and what I see with barriers to care for my patients is where they live. And some of them drive to Hershey, Pennsylvania, through 2-3 hours to get to us. And their care has been fragmented because of where they live in the rural Pennsylvania. And to answer your question, I think, sir, from what I see with my physicians, is that everybody needs to follow the National Comprehensive Cancer Network guidelines for cancer care. And that's driven all over. It's not something they've just made up. It's something you all look at. And my patients who don't do well have started out wrong where they were. And it needs to be standardized. And those doctors in the rural communities need to be encouraged, and maybe somehow, I don't know how to make it happen, that they are not starting in the wrong place. Or that they're not starting with the wrong treatment because of where they live. There's a lot of rural areas in Pennsylvania, Virginia, West Virginia, you know. And barriers to care can be even having gas money.
Yes.
You know, so just my 2 cents.
Thank you. Thanks, everyone. Was there one more before we?
Okay, we have 9 more minutes.
Okay.
I had a comment don't speak into it probably. So about the survivorship care plan, you know, we get a lot of paperwork in the beginning of our diagnosis. We get a lot of questions every time we come in. You know, someone will ask you a bunch of questions all over again. You know, having a blank form with those topics or procedures or whatever that the form is going to look like after surgery or after treatments might be good to have then. So that way then, of course, we're not going to think about it at the time. Maybe our caregiver will look over our paperwork and think about it. Possibly then after chemo or surgeries, it's in our packet. So we've already got an idea that this is going to come about. So then when you talk about survivorship care plan from a physician's point of view, we've also now have something to start with instead of not even knowing that's going to occur. So it's just something to have on our mind, or our caregiver could have on our mind, you know, as we finish treatments.
Thank you.
Yeah, and I do want to say from electronic, I think it's much better than it was years ago. We didn't have electronic medical records, so I think we're getting better and better. But I think it's great. Yeah.
Yes, progress for sure. Thank you. That is one thing that.
Sorry.
Oh, go ahead.
May I answer her question?
Yeah, of course.
Sorry, I lost you guys for a few minutes from California. So I think those are all great points, and I feel like as clinicians, it's going to be also our job to sort of plant that seed during your pre-op journey, post-operatively, or regardless whether you have muscle-invasive or non-muscle invasive cancer. I think, as we said it before, it's sort of an ongoing, living, breathing, document. So I think planting the seed from a clinical end is very important. And then probably many of you have seen for your survivorship visits, if the facility has Epic, it sort of sends you out all these millions of questions, and most of those questions are unfortunately in urology are not targeted. So I cannot tell you how many patients I have who will tell me, well, they're asking about my prostate function and BPH, and it has nothing to do with what we are doing here. So I think also from a clinical perspective, when we are getting ready for survivorship visits, longer term, I think the goal is to have a really specific embedded questionnaire prior to your visit, so we can focus on those aspects also.
Thank you, Krisztina. Yeah, to your point, something we've talked about in the task force is introducing this concept of survivorship earlier on. So thank you all. I do want to make sure we touch on what's in the works before we run out of time. So one big thing that's in the works, so that's I will be here all day if anyone has questions for me. That's in the works that we are really excited about and really proud of is we are focusing on some resources surrounding emotional and mental health. That's a topic that's come way up to the surface when we've done some of our surveys, and it came out of our think tank session this year, which was very well attended. There were a lot of people there who are in the room today, and it was just a phenomenal panel. So what we know, this was an old survey, is that one of the major things that folks think about when it comes to their mental and emotional health is fear of recurrence. Thank you all who completed the pre-survey to this meeting. The thing that popped up, two big things were physical well-being, worrying about the future, and what lies ahead. So we are currently working on a mental health 101 fact sheet, and there will be more specific things that are extrapolated from that, so that we have a dedicated space for mental health on the survivorship webpage as well. So more on that to come. We've got great folks working on that with us. This is just things that emerged from the think tank 2024. I keep saying 23. That's incorrect. And then I think that's my last slide, and we have 4-ish minutes.
So great opportunity for additional questions. Thank you so much for using the microphone, because we are recording, and if you don't use the microphone, it doesn't always pick up. So if you have a question, just raise your hand and we'll get the microphone to you. We have a couple of them.
Thank you.
Hi.
And survivorship plan, and fortunately or unfortunately, I don't have a plan. And I've been a survivor for 12 years. And, my plan was my wife. And, when we left, I still don't have a plan. I do go and, I feel I have the best medical care, but I still don't have a plan. And before I came for information, and I thought I was going the right way. Now I realize I'm still down here a little bit. I got a little more depressed, where I never was depressed or thought about it. I live life to the fullest. I realize how much I don't know. And, for everybody else, like I said, I've been doing it for 12 years. And, knock on wood, it's been a very good 12 years. And even though my doctors were from Duke, I know that probably does not set well with you.
I went to grad school there.
And maybe that's why I don't have a plan. If I had UNC, I might have had a plan. But the whole thing is like you said, you get the medical records. I guess that's where you just start. I mean, where do you start now? 12 years into the plan. Yeah. I don't know.
Thank you for sharing that.
I just have a comment.
Hi.
Is this working? Okay.
It is. Hi.
Hi. I just have a comment. I never received a formal plan after my diagnosis and surgery. But as a bladder cancer survivor, I took steps on my own, things like getting enough sleep, change my diet, try to eat more healthy, try to eat more fruits and vegetables, exercise, and try to live a healthy lifestyle on my own without a formal plan. And I encourage everyone, all the survivors out there, that if you don't have a formal plan yet, please take steps to try to live in a healthy manner. Things like smoking cigarettes are not good, but enough sleep, stress reduction, getting enough exercise, and diet are very, very crucial. And that's all I have.
Thank you. I think one of the most important things that we tell folks is whether it's at the time of diagnosis and through the extent of your cancer experience, is controlling the things that you can control, which is good for your overall well-being, your physical well-being, and your mental health. Because when life feels like it's flipped on its head and everything's out of your control, when you can focus on those things that are good for your overall health, like the list you just shared with us, it's crucial, and it can give people a sense of feeling like they have control over something.
And, bladder cancer, you deal with that, but there's other stuff that sometimes you're dealing with one thing, like the fire in front of you means you forget about the little fire that's over on the side, maybe the heart disease or something else. So at some point you get to that place where you feel like, okay, I'm on stable ground now. You got to pay attention to all the other things, which quite honestly, once the warranties are up, like I just turned 65, the warranties start to fall off all the time. It starts to go wrong, and you've got to pay attention to all of these other things. And when you're facing this big monster in front of you, it's hard. So, that's part of the survivorship, is there's other things. Living well beyond your bladder cancer doesn't mean dying next week of heart disease. Let's come up with a better way of keeping track of overall health so that it's quantity of life and quality of life. Those are really important pieces to that. So, Mary's going to be here. I'm sorry Kristina's not here to stick around with us, but certainly the working group is always accepting new members. We meet virtually, so we have plenty of room in this space. And let us know if you're interested in being part of that. We are now going to break for lunch. Perfect. I'll leave one last minute for Mary and Krisztina if you got any last words.
Thank you all. We couldn't do this. We wish we didn't have to do this work. I tell people all the time that I wish I was out of a job, because that means that no one would have cancer. And since that's not the case,
great.
It is such an extraordinary privilege to be able to be an oncology nurse practitioner, to be able to work with people who are going through a cancer experience and their families, regardless of where they are in that experience. So thank you for letting us be a part of your lives. Thank you for the feedback that you give us. Thank you for keeping me on track during meetings. And thank you for being vulnerable so that we can do what we can to help make this experience better for all of you. So thank you. It's a privilege. Thank you.
And Krisztina, any last words?
Thank you. This is so weird not being there in person. This is the first time remote, so I'm slightly traumatized.
It's weird.
Everybody turn around and wave to Krisztina so she can see you.
Hey,
She's only seeing the back of your head, so turn around.
I've seen so many faces. Thank you, guys. So I just want to say that I think at the end of the day, nurse practitioners play a huge role in your care because we are there from day to day, right? We are not just there during your surgical period, but long term. And I have to say that I don't think I've had more kindness and empathy and humanity and whatever words you want to attach than seeing the journey from my bladder cancer patients. And even on a personal level, when I've had some major life-changing events in my life, by far, hands down, the people who were there for me over the years are my patients that some of you guys became very close friends who have my cell phone number and get messages at 9 p.m. on a Saturday needing to transfer to another hospital. So it's been a privilege, as Mary said, and I'm looking forward to seeing a lot of you in San Diego.
Yeah. Thank you both. I can't tell you how helpful both Mary and Krisztina have been, and this really goes to that saying, if you want something done, ask a busy woman, because these women are insanely busy and they give so much. So thank you both for joining us. Krisztina, we're going to sign off. And we are going to break for lunch. There's wonderful lunch out there. Come on back in, mix it up, meet some new people.